So my name is Gayle, and I'm a specialist heart failure prescribing pharmacist. So my role involves working across the care boundaries to help ensure medicines optimization. And this is facilitated through pharmacist-led clinics and working as part of the wider MDT supporting primary care. So what really motivates me is trying to deliver the best possible care I can to the patients I see. From personal family experience, ensuring patients feel involved in decisions about their medicines is really important. So as part of this, I try and provide them with the individual support they need to enable them to take their medication the correct way, keep them feeling well and keeping them out of hospital. So for me, that's a really big motivation. So MedTap is a free medicines information and reminder app that has been developed by clinicians at Guy's and St Thomas's. And using MedTap, patients can access short information videos providing similar information to what is discussed in their hospital or outpatient consultations. So it's like having a recorded version of the consultation on your phone. And so patients can access the specific information they need at the time when they need it the most, which is usually when they're at home and not with any healthcare professionals. Patients can also add their medicines in a medicines list and set a reminder to help ensure that they never miss a dose. So patients not taking their medicines as intended can have a significant impact on the management of their long-term condition. And this can lead to deterioration in their symptoms and also possible hospital admission. And we know that when patients come to a hospital environment or for either an inpatient admission or in the outpatient setting, it can be a really overwhelming experience where a lot of information is provided. And often that information provided, only a very small amount is retained by the patient. We also know that what patients want to know about their medications or condition often differs from what healthcare professionals tell them. And this can often be around why a medicine is important and how this affects their lifestyle and practical advice on how to use it. So the idea with MedTap is it helps support patients better understand their medicines and conditions to allow them to be able to recall this information when it matters the most, with the aim of hopefully improving their satisfaction with the information that's been provided, but also ultimately to ensure they better can adhere to the medication that they've been given. So being part of King's Health Partners has allowed me to access a wide range of expertise that I wouldn't otherwise have known about. And this is especially true of my work with MedTap. Through MedTap, I was introduced to Dr. Chua, who is a health statistician at the School of Implementation Science. And this is a whole area that I wasn't aware of until kind of being introduced to Dr. Chua. And actually implementation science has had a huge impact then on how I've looked at and using MedTap. It's about translating great data that we have from clinical trials, taking that through to actually patients implementing it in their own practice. So my number one piece of advice would be to find some research mentors. I think it can be really overwhelming sometimes to know where to start if you want to get into research or really with any project in terms of writing up and looking for publication. So using kind of expertise that you have around you kind of through King's Health Partners or kind of more locally is really important. But I've been really fortunate to work with some fantastic people who really helped and encouraged me not only to develop as a clinician, but also to become more research active and have supported me with this. So Dr. Vivian Iron was a senior lecturer in medicines use who previously worked at King's College London, and she was my first mentor. And we completed a project together when I was a junior pharmacist that led to a publication. And even once that had finished, she was just always available for help and advice kind of when I was looking to perhaps do different projects or move those forward. And more recently, Dr. Tefik Ismail, who's a consultant cardiologist at St Thomas's and a reader at King's College London, he's also been a mentor and at any point will happily read any kind of work that I've written, provide advice and support on how to take that forward. And I've just come off the call with him earlier where he was helping me look at some data I've collected and really looking at how I can better write it up and kind of mold it into something that can be published. So I think what's really been amazing, especially kind of through King's Health Partners and what I've had the ability to access, is that when I've asked for help and support, especially from my research mentors, that they've always been there to provide support and advice. And I think that's something that's been invaluable. So definitely research mentors for people that are looking to get into research are is an absolute must.